Assalamualaikum, I'm Moneeza Tahir and my registration number is 2021 dvme 023 and I'm from A to evening. Today my topic of discussion of the case report is basically dystocia in the guinea pigs. So first of all, if we're going to start from the introduction, guinea pigs, they usually have the gestation length of about 68 to 72 days, and their labor usually lasts for about 30 minutes with the short breaks of about 6 to 7 minutes in between each fetus. So breeding before 6 to 8 months is actually recommended in the guinea pigs. Why? Because of if we wait till the 8 months, then the pelvic symphysis fusion will happen and it will cause the stiffening and mineralization of the pubic bone, which will basically cause dystocia in the guinea pigs. Other than that, dystocia is very normal in the guinea pigs because of the large size fetus. So this can actually cause problems in the guinea pigs later on. We see that there is this type of dystocia, then surgical intervention will be needed. Okay, so now we're going to look at the case description and the history. So there was a guinea pig. It was actually primiparous female guinea pig, and it was presented. It was 8 month old, weighing about 880 gram. So we're going to look at the age of the guinea pig. It was 8 month old, so we already know what's going to happen. And it was presented with the chief complaint of dystocia with a 12-hour labor. Guinea pig was gotten from a commercial farmer, and after the 12-hour labor, the guinea pig actually delivered two pups. One was alive and one was stillborn, and there were three fetuses inside the guinea pig as well. So we had to do a little bit of surgical intervention in there. The owner actually injected the oxytocin and calcium to the guinea pig, and it was without any veterinary recommendation, and the exact dose is also unknown. Okay, so on clinical examination, we observed three things. We observed the distended abdomen. We observed that there was no uterine contractions, and there was mucoid vulvar discharge. Okay, so then we performed the radiography of the guinea pig, and we observed that there were actually three fetuses with no viability. So these were basically the radiographs of the guinea pig. At the first, we're going to see the ventrodorsal projection of the three fetuses, and then there is the lateral projection of the fetuses. Then the treatment, basically we performed C-section with the ventral midline incision, and then we also performed ovary hysterectomy of the guinea pig with the very normal post-op therapy with the antibiotics, NSAID, analgesic, and the gastrointestinal support. And the prognosis in most of the cases is actually not good in case of guinea pigs with the dystocia, but in that case, the surgery went very well and the guinea pig actually recovered very well. Okay, so now we're going to discuss the pathophysiology. In the guinea pigs older than 8 months, it basically increases the chances of pubic symphysis mineralization, which prevents the widening during the parturition, and it also increases the dystocia risk. Other main causes can also be due to the large fetus size, uterine inertia, malposition, and obesity. In this case, fetuses weighed almost 110 grams each, so that actually there were three fetuses, so basically that represented 63% of the mother's body. The owner's unsupervised administration of the oxytocin and calcium worsened the uterine rupture risk. Proper management involves the early imaging and surgery if obstruction is confirmed, and the prevention through the early breeding and veterinary monitoring is the key. So we're basically going to conclude that the dystocia in the guinea pigs is multifactorial, commonly due to the delayed breeding and large fetus size. Early diagnosis and prompt treatment is actually necessary. Despite the successful surgery, prognosis is still guarded, so we're going to mainly focus on the prevention of the dystocia rather than the surgery. And in the last, here are the main learning points, which basically includes that dystocia requires the urgent veterinary intervention, and avoid giving the calcium and oxytocin to the guinea pigs without the veterinary supervision. Ovary hysterectomy is actually recommended in case of obstructive dystocia, and post-op monitoring and care is required for the full recovery. Thank you.